Good afternoon, everyone, and thank you for joining us. This is Paige Hancock, Marketing Manager at Spok, and I'll be moderating today's webinar. Today, we'll be talking about how to give your nurses more time at the bedside. Katie Cornwell, Director of Clinical Marketing at Spok, will share how technology can aid in shifting nurses' time back to patient interactions and help achieve impressive results. Before we get started, I would like to go over a few housekeeping items. Everyone will be muted during today's webinar, but we welcome your participation. Please submit your questions via the questions box in the GoToWebinar toolbar, and then Katie will answer as many questions as time allows after the presentation. A recording of this webinar and the presentation slides will be sent to all registrants tomorrow. We encourage you to share these with others at your organization. At the end of the webinar, you'll have the opportunity to complete an evaluation. We would love it if you could take a couple of minutes to complete this brief survey. Your feedback helps our efforts to provide you with relevant and informative presentations. And with that, I'd like to turn it over to Katie, who will begin our presentation.
Thanks, Paige. Do I have control? Yes, okay. Hello, everyone, and thanks again for taking the time to join today. Just as a brief intro, this is a quick look at my path from bedside nurse to healthcare IT. I started in the neonatal and pediatric intensive care units as an RN, and then went to grad school to earn my neonatal nurse practitioner and clinical nurse specialist degrees. Several years ago, I had the opportunity to consult for a medical device company on a suite of neonatal ICU products that they were developing. That experience turned into a full-time position as a medical device product manager for almost 8 years. At that point, I had the opportunity to take a product management position in healthcare IT, and I am so glad I took the leap. I joined Truven Health Analytics, which is now a part of IBM Watson Health, and manage their clinical decision support solutions for critical care, neonatal and pediatric drug dosing, along with a platform of solutions designed for patient and population engagement. When I joined Airstrip a few years ago, I led the marketing team strategy in support of our company mission to drive interoperability for data-driven decision support at the point of care. And then last June, I joined Spok as the Director of Clinical Marketing, and I'm just so happy to be here. This really is a great company to work with and for. Uh-oh. Page is not advancing. Oh, now it advanced me. 1 second. Okay. Okay. There we go. So speaking of Spok, this is our mission. Delivering clinical information to care teams when and where it matters most to improve patient outcomes. Spok is passionate about critical communications in healthcare, and that means to us, every message is important because we know that minutes and often seconds really matter when it comes to providing the very best care to patients. That's where our experience and expertise in working with our hospital customers to help evolve their communications from the many disjointed and often non-interoperable systems already in place to a single communications platform can make such an important impact. When connected by a single unified communications platform, oh dear, sorry. When connected by a single unified communications platform, truly a single source of data across departments, across stakeholders, and across applications, all of the once disjointed pieces and parts unite to deliver fast and easy clinical communication and collaboration enterprise-wide. We know that our nearly 2,000 hospital customers use Spok every minute of the day in some fashion. But these are the most significant and impactful ways that they all leverage the CareConnect platform. First and foremost, effective clinical communication requires the ability to quickly and reliably connect people to people so that they can collaborate on the best care for their patients, both inside the four walls of the hospital and out. When we talk about mobilizing patient care events, we mean providing caregivers with the right actionable data and information on their device of choice when and where they need it to make a clinical decision and act on it quickly. That mobilization of information and communication also serves to better enhance coordinated responses to critical workflows like codes, because the faster all the team members have the information they need, the faster they can act and respond. So what does that all look like behind the scenes? And how do we actually put all of the pieces of the puzzle together? Well, the Spok difference can really be broken down like this. First, we offer multi-device support. We don't require our customers to implement a specific type of communication device. We support communication via pagers, mobile, and on the web, and we can leverage end user preferences and escalation patterns. Next, our solutions are multimodal, and that means we include communications pathways through hospital operators, secure messaging, voice and speech recognition, and other multimedia modes. We, of course, achieve interoperability between EHRs and also a wide variety of other devices and nurse call solutions. All of this is dedicated to connecting the care team, leveraging and managing the physician's on-call schedule, care team assignments, and critical event teams. And all of that is driven by the enterprise directory that truly is the single source of truth for all contact information for all members of the health system. So just a little shift here to draw a line between our Care Connect solutions and the real world problems that they're helping our customers solve. When we're talking with nursing leaders, we often ask them about what keeps them up at night. And these 4 buckets represent what we most frequently hear from them as their greatest challenges. They are improving the patient experience, improving patient care quality and safety, nursing staff retention and recruitment, and keeping up with the ever-accelerating rate of change, especially when it comes to technology. These are all probably very familiar and potentially sleep-stealing issues for you too. So let's dig in a bit here. When it comes to improving patient experience and the related implications for HCAHPS scores, improving nursing communication is often cited as a top priority. And as we know, HCAHPS and CMS quality scores carry significant weight in many organizations' metrics for evaluating overall nursing staff performance. We also know, both from results of dedicated research and from personal experience, that these 3 elements go a long way toward improving the patient experience. The quality of nursing care that's delivered and received, consistent and collaborative working relationships among the caregivers, and of course, adequacy of staffing resources. Further, when it comes to the next major focus of these 4 primary buckets of challenges for nursing leaders, patient care quality and safety, these 4 factors are major influences. First, in line with that last mention of staffing resources, is nursing workload. Then also closely related is nurse-to-patient ratio. Also, working conditions and frequency of interruptions, along with access to and availability of colleagues. And this all leads us to a great opportunity for a live poll. Our question here is, which activity takes up most of your nursing staff time during an average shift? So is it patient assessment and interaction, patient care procedures at the bedside, interacting with technology, or in-person collaboration about patients or patient care? Feel free to place your votes now, and we'll let that tabulate. Okay, so this is absolutely in line with the many conversations we've had with nursing and nursing leaders that while technology can often be very helpful, it is also often seen as the enemy to nurses' time overall. So, based on that response and what we've, like I said, what we've heard across the board, it's not really surprising that nurses have shared in a variety of ways that they're ready for a change, for a variety of reasons, including they're very busy, they're more busy and overwhelmed than ever. Today's patient mix is much more complex and requires much more interdisciplinary care than ever. And in this age of rapid technological advancement, nurses remain highly dissatisfied with their technology-based options for communication. So looking to the future, it's clear that there are strategies that we can invest in to help bring the change and ease some of the burden. Things like virtual nursing to help lighten the load, of course, expanding the reach and usability of mobile technology, and creating processes and even procedures that dedicated to bringing nurses back to the bedside. And the outcome of this would be the major factor that would make a difference here would be putting nurses at the center of nursing, at the center of communication, like we see in this image here, through tools that help prioritize and optimize location, presence, and availability. And central to building systems and workflows that put the nurse at the center of communication is mobile messaging technology. A mobile nursing team, one that really is always on the move, must be able to send and receive vital information quickly and easily. It jumped a slide and I can't make it go back. There we go. Thank you. Okay. So I'll start over with this slide. So like I was saying, central to building systems and workflows that put the nurse at the center of communication is mobile messaging technology. A mobile nursing team, one that is truly always on the move, must be able to send and receive vital information quickly and easily. This means that they need tools that prevent phone tag by allowing them to text important messages to physicians and other members of the care team, and to seamlessly access on-call schedules and groups right from the device, right in their hands. Effective mobile messaging solutions should also provide templated message options to simplify and speed along that process and the task of messaging itself. Further, easy connection to and collaboration with the care team is vital all on its own, but it also serves to improve patient throughput and satisfaction by helping to accelerate processes like handoff and transfer. Okay, can you go to the next slide? Thank you. As we noted on the last slide, easy access to a trusted single source of truth directory is a fundamental component of an effective mobile messaging solution. Nurses have to be in constant communication with the care team. It is extremely helpful to them to eliminate that time wasted by searching for numbers in a binder or wherever else they might be housed, none of which is as convenient or reliable as a directory that can be accessed, again, right from the palm of your hand. Next slide. The last bullet on the previous slide mentioned the positive impact need to go, sorry. Apologize, I just dropped my notes and I just need to pick them up real quick. They were out of order. There we go. Okay. Can you go back a slide, please? Thank you. Okay. In addition to constant communication, nurses caring for multiple patients and their families need to be mentally in multiple places at the same time, all of the time. Mobile solutions that can deliver intelligent clinical alerting right to the nurse's mobile device truly do allow nurses to be as mobile as they need to be, but also to stay continuously connected to their patients wherever they are. Solutions like these also offer the ability to quickly discern the criticality of that alert. Can I walk or should I run? And further provide an extra layer of security by allowing for escalation in the event that the alert is critical, but the primary nurse isn't in a position to leave to attend to that situation immediately. Next slide. The last bullet on the previous slide mentioned the positive impact a mobile solution that also delivers alerting can have on managing a 12-hour shift. And this slide is a good example of that, along with the obvious potential positive impact on patient comfort and satisfaction. This workflow, enhanced by Spok Care Connect, starts over here on the left, with the patient in pain using his nurse call button to call his nurse. His nurse, at another bedside, receives the mobile alert and is able to call right back to the patient's pillow speaker to respond. After talking with the patient, the nurse is able to submit a pain medication request directly to his doctor right from her phone. The doctor receives the alert from Spok on his mobile device and then places an order remotely. And that means that the patient ultimately receives his pain medications much more quickly, with minimal audible disruption, and while minimizing the interruption to his nurse's other tasks at hand, all of which should help provide that nurse more available time at both patients' bedsides. Next slide, please. This slide shows a similar workflow but highlights the positive impact of a mobile solution like Spok can have on care team collaboration and, of course, ultimately patient outcomes. Here, the patient monitor signals an elevated blood pressure, and the alert is sent directly to the nurse's Wi-Fi phone. And although he is not at this patient's bedside at that moment, he knows that collaboration with this patient's doctor is needed in this situation. So he's able to send a secure text to the physician detailing the patient's status and requesting a new medication. The physician receives the message on his mobile device and places a new order. And then a notification is delivered to the nurse that the new order is available. Again, the workflow is streamlined and simplified. The nurse is alerted, no matter where he is, of a situation that needs his attention. And he is able to act on the move, very likely from another room, without leaving it. A smoother, more accelerated process like this one that allows for quick action but doesn't require interruption like leaving the bedside can also certainly help improve the nurse's sense of available time at any bedside, and also improve both patients' satisfaction. Next slide, please. So the workflow represented here also demonstrates the role of a mobile communication solution like Spok and the impact it can have on speeding the process of patient discharge coordination. And importantly, it also highlights its role in helping improve patient satisfaction, because our patients' last memories of their hospital stay, truly their final impressions, will be the discharge process. In this case, the physician can enter the discharge order in the EHR and know that Spok will alert the care team to start the process. That includes not just notifying the patient's nurse, but also leveraging access to staff assignment, on-call schedules, and device preferences maintained by the Spok Care Connect platform to include notifications to the charge nurse and any other specialties like pharmacy and physical therapy that may be involved in the patient's care and discharge planning. And Spok also notifies services like transport and housekeeping to help augment this process and improve patient flow. Ultimately, everyone is on the same page and better able to coordinate the whole process together, more efficient for the nurse, helps ensure the care team remains coordinated throughout the entire patient stay, and helps improve the patient's last experience at the hospital, and also accelerates the bed turnover rate. Next slide, please. Here's a bit more granular look at the discharge process that can be augmented by Spok. In this case, Dr. Gold, during his morning rounds, visits his patient Jill, who he expected to be ready for discharge today. During today's visit, he confirms that yes, she is ready to leave, and talks with her about a new medication that she'll need to take when she goes home. From there, he's able to enter her discharge and new medication orders into the EHR, where Spok then references scheduling data to send the discharge order to Jill's nurse, the charge nurse, housekeeping, and the patient placement team. Jill's nurse is also alerted to the new medication orders, which she will then include in her discharge teaching. This process, again powered by Spok, can help minimize the waiting game, often characteristic of the discharge process. Jill's nurse knows right away when the discharge orders are placed and can start acting on them, and so can the rest of the team, improving the nurse's experience and her efficiency, and helping give her more time back at other patients' bedsides. And again, helping with her discharge patient's last impression on the way out the door. Next slide, please. So as we walk through all of these clinical considerations, technology recommendations, and representative workflows, hopefully you've seen areas where investing in a clinical communication solution like Spok Care Connect could make positive impacts on those key areas that keep nursing leaders up at night. Next slide. And in extended conversations with nursing leaders about the value of Spok Care Connect, they also often cite its role in compliance with magnet pathways and certification, physician and nurse satisfaction, and CMS quality ratings. Next slide, please. But before we wrap up for today, I also wanted to take a moment to touch on an important fact that we all already know, that we nurses pursue this profession first and foremost to provide care for patients in their time of need. So it really is so important to honor that in a variety of ways, including providing the right technology to maximize and optimize your nurse's ability to provide that unique level of care to everyone. Next slide, please. Thank you all again for your time today. I think we do have a few minutes available for any questions.
Thank you, Katie, so much for that insightful presentation. We do have some time available, so we'll go ahead and answer audience questions. It looks like we've had a few that were submitted already. Just as a reminder, if you have a question, please submit it in the questions box, and then we'll answer as many as time allows. So Katie, our first question is, what system are you interfacing with to obtain the staff assignments?
If you have Spok?
Yeah. So in the scenarios that you talked about, they asked if it was the EHR or the nurse call system or another.
I believe it is situation specific, but we are able to interface to pull that information and then route those messages appropriately.
Beautiful. And we can follow up with you more offline to figure out what situation specifically you're looking for. Another question, Katie. Does the EHR interact with the Spok system, or is it independent?
So the Spok system can receive notifications from the EHR, so that when, like we were saying in one of those earlier workflows, when the doctor places the order, the notification can be sent to the nurse that the order has been placed or a new medication order is available. So we're able to talk to the EHR and get those notifications delivered to the appropriate caregiver.
Excellent, thank you. Another attendee has asked, people are blaming a lot of burnout on technology use. How could you implement the technologies you talked about without just adding to burnout?
I think that is a great question, and one that Spok's CNO, Dr. Nate Guyton, talks about a lot. And the one thing that she recommends as the priority is making sure that when you're making a decision about implementing a new technology or technologies, to really look at your workflows and where you need to make improvements, and do these actually make a tangible improvement, or are they just sort of adding an extra layer of complication? And then secondly, and as equally as importantly, making sure that all of the end users, in this case your nursing staff, are bought in, are on board, and understand why we're making this investment and making this implementation, and understand and agree with its potential impact. So assuring that it does address your needs, and then also keeping your staff engaged in the entire process.
Thanks. Another question that came in, we have some nurses that want to use their personal device, and then others that prefer the hospital provides them a device. Do you see anyone using kind of a combination strategy?
Yes, and that's actually one of the strengths of the Spok solution compared to competition, is that we can work with the strategy that the hospital has in place. So some have a BYOD, bring your own device strategy. Some have a mix of BYOD and hospital provided devices. Some have just hospital provided devices, and those represent a variety of different types of devices. So really, we're able to come in and say what's the scenario that you'd like us to fit, and we're able to fit it.
Thank you. Another question kind of related to devices. Someone has asked, are you seeing any trends in the types of mobile communication tools that are being used by nurses?
In our conversations with our customers and potential customers, we see a pretty wide variety from the voice badges to, like I said, bring your own devices to purpose-built phones and Wi-Fi phones for nursing. So I think I couldn't probably point to a single trend, except that overall there's understanding of the importance of putting that vital information in the hands of nurses on the go so that they can stay on the go and hopefully be more productive, be more efficient, and open up more time back at their patients' bedsides, which is their goal.
Great, thanks. It looks like we are almost out of time, but we've probably got enough for one more question. Another attendee has asked, do you have any recommendations on end user adoption and how to get my nurses using technology?
So I think that one goes back to that earlier question about making the decision about technology, and what our CNO always brings up, and that is getting the nurses involved in the decision-making process as early a point as possible, so that they understand all of the background that goes into, maybe if you're coming down to one or two vendors as your final choice, and how did you get there, and what are you looking at to make the final decision, and have you taken in the nurses' feedback and concerns, so that no one feels like they're being force fit or just handed another layer of technology that they weren't expecting or didn't think they needed. It's that buy-in from step one that really seems to make the ultimate the biggest impact on ultimate adoption after go live.
Excellent, thanks, Katie. Unfortunately, we are out of time, so we will go ahead and conclude today's webinar there. If we were unable to get to your question, we will be sure to follow up with you offline. And if you'd like to chat with a Spok representative on the topics that we discussed today, you can do so using the link in your chat box. You can also continue the conversation with fellow attendees by using the hashtag SpokWebinar on Twitter, and follow us on Twitter, LinkedIn, and Facebook to get all of the latest news from Spok, as well as industry news and trends. Thank you all again for joining us. We hope that you found this webinar informative and that you have a great rest of your day.
Thank you.